Hello everyone, how are you? So as you know, in general, mandibular canines will have a single root. But did you know that sometimes they can have two roots with two canals? So in today's video, I'm going to show you a anatomic variant where the patient has two canals with two roots. So look at this axial view, and I'm gonna have you look at this tooth. So at an initial glance, it may not appear like a canine, but I can assure you from this occlusal plane or occlusal level, what you're seeing is molars, two premolars, and canine tooth number 22. And then as we go toward the apex, we can see right here, you see the bifurcation of the canals into a buccal and lingual. And the roots also bifurcate as well. Now let's take a look at this from this cross-sectional view. So come over to this side. By the way, this is a incisive canal that I've traced from the previous study. So I know I'm kind of going off the main topic a little bit. Here's a mandibular canal, and here's a mantle foramen. Whatever the remainder of the canal that continued to extends anteriorly, that's called incisive canal. And at times you see it really well, at times you don't. And I have seen a few cases, not many, but a few cases where I was able to trace all the way to the midline of the mandible. All right, so now let's go ahead and focus this canine again. So this is canine. You can see the main branch, the pulpal space bifurcating again into buccal and lingual with two roots. And how would that look like from the facial view? Here is where the bifurcation occurs. So I don't have a periapical radiograph, but what typically happens with a case like these is where you can see the pulpal space very well up until bifurcation, and from that point, it's very difficult to trace the remainder of the canal just because they are divided not only into two, but now they're much smaller in size. So if you see that on a periapical radiograph where you suddenly seem to lose the pulpal space, then that's a very good clue that it may be bifurcating at that location. So that's it, folks. I hope, again, this was interesting and helpful. And I will see you in the next video. Take care.